Thank you very much, Jose Luis, and very kind introduction. Ronald did me a favor because he um, was brief, so I will begin with my presentation. I will be speaking about the experience of Mexico with regards to dengue in times of COVID-19. This shows the members of our team that we've been working with from the central office in Mexico, from the National Center of Programs for Con- Prevention and Control of Disease. All this was done by the National Service of Public Health in the country. So now we will see in the next slide that, as has been said before, the pandemic has been one of the greatest challenges that we faced by healthcare systems. It has really required from us an vision of national and worldwide priorities in healthcare, in economy, and human rights. It has tested our ability to respond from the health services against COVID-19 without neglecting that care of other acute and chronic diseases. It has affected the presentation of other diseases and has allowed us to explore new ways of working. This is certainly an opportunity to reflect on our work and how to approach it. In the next slide, we will see the situation of Mexico. As in the context of other Latin American countries, we come from an epidemic year in 2019, where the main concern has been the 371 deaths. This was one of the highest numbers with regards to dengue in our country. And as I said, this probably in 2020 it could be an epidemic year, but also a year with a high number of deaths. Therefore, part of the clinical training was an area that we were careful since the beginning of this situation. So now we will see how COVID evolved in Mexico. We are thinking on how to prepare ourselves to update the clinical um, the clinical information. And we had the first confirmed case in Mexico on February 27th, and in March we already had um, the distance, social distancing, and stay at home. Um, Statements, and this limited suddenly mobility of the population. And of course, there was a risk of that the dengue surveillance would diminish because of the priority given to COVID-19. And what happened was that the training for care of dengue was discontinued, and we are in April found ourselves in phase 3 with an important community transmission in our country. That led to the fact that the care professional and also those dedicated to vectors was added to the rest of the healthcare professionals for the fight against COVID. The actions then in vector control were limited because of the measures of social distancing, although they were not discontinued completely. They remained constant, but of course with limitations, as we will see later. By June 1st, we had seen until then one of the most complicated phases, and by June 1st, we entered in what we now call the new normality. This is a very important phase because the beginning of there was a reactivation of public life, and confinement was decreased, and this has to do with the increase in economic activities, which of course exposes us to new risk. What happens with a personnel dedicated to vectors that is partially assigned to other functions? Also, some of them are in the groups at risk because of either age or chronic diseases, and of course they were also affected by COVID-19. We had tens of people that was healthcare professional that fell ill because of COVID, and we also had some deaths, unfortunately, of some of our colleagues that were affected by the pandemic. Activity increased was confinement was relaxed, but there was still is difficult access to the homes of the community because we still are limited in contact and social contact because of the safety measures. And also we have to face some myths regarding the sanitization actions and fumigation activities for dengue. So how do we approach all this? In the next slide, we will see the problems that we faced because of the simultaneous occurrence of COVID-19 and dengue, especially in cities that have high, numerous population, levels of population. And so I will emphasize on some of these issues. The first thing is the mistrust that affects the population, limits its participation. The second issue is the difficulty in training and providing medical care for dengue. That is, of course, um, all focused on COVID. And the third point is that it was to evaluate the performance of the epidemiological surveillance, and is affected in our countries the surveillance with OV traps and the limitation of for controlling the vector during confinement, and uh, problems when confinement is relaxed as to control of vectors. And the sixth point is how to test the efficacy of the operating models in a scenario that is completely new, such as COVID poses to us. In the first point will be analyzed. Mexico established a policy of information whereby the government establishes every day one conference or report at a national level. And the first stages, with regards to COVID, they explain what happens in the national territory, and as the epidemic progressed, several points were incorporated. And here we add in some of the presentations, we address the issue of dengue and how it evolved during the pandemic. With regards to health promotion in Mexico, they were saying, okay, if we're all confined and at home, we have to speak about eliminating the breeding grounds for the mosquitoes while you're at home. This helps in the sense that the population can participate sanitizing their homes and reducing the risk of transmission in the breeding areas for mosquitoes. The personnel assigned to vectors is in charge of trying to fight this mistrust because they visit the homes for vector control. And the next slide shows the second point regarding the training regarding medical care for dengue. Since the beginning of this year, the National Health Council and the National Center for Preventive Programs and state services healthcare agree to strengthen the clinical training. For that, SENAPRES integrates a national network of clinical experts with one expert of each of these areas, and we ask the support of PAHO for this training. When we requested this support, this social distancing measures were announced in Mexico, so that we no longer could have the support in presence. And so the health services were prepared to convert medical units to become COVID units, and the training plan was discontinued to focus on medical care for COVID. We see here what the situational diagnosis was, and the strongest um, phase of the pandemic, we had 30% of medical um, personnel was not working because of being population at risk or because of they were uh, ill due to COVID. We have four state coordinators who have um, fallen ill with COVID-19. 80% of the state coordinators are hospital responsible for the care of COVID-19. And so that led to uh, find practical options adapted to the reality that we were facing. So PAHO proposed us to start a training plan that I will now proceed to explain. In April, we had um, with PAHO in Washington and the regional clinical advisory group that sends material to Mexico for training. Jose Luis mentioned this in the morning, and those materials were prepared by people that you know well, by very prestigious colleagues such as Eric Martinez, Anabel Alfaro, Ernesto Pleites, Gamaliel, Jose Luis, and participation as well as of two Mexican experts, Dr. Rosales and Dr. Guadalupe Martinez. The contents that they provided us that gave us great support are updated clinical criteria that are accessible for the first level of care. Something that we need not so much for the high levels of treatment for the intensive care levels, but rather the first primary care level with modules of weekly um, sessions. And in 4 weeks, 90-minute sessions, we are able to train the groups that attend these trainings. For that, PAHO authorized us to distribute these didactic materials to all the clinical network in Mexico. And we see how we started seeing results. We need to clarify that the didactic materials are reviewed with PAHO and with the clinical group in Mexico during virtual sessions. They help us adjusting some of the content, and this is related to some of the needs that the clinical national leaders report in our countries. The final product is a course that has been adapted to the needs of Mexico with more than 3 months of careful preparation for 6-hour content. The course is brief, but the preparation process is quite lengthy and careful in order to have a very high quality product. In the first course, we had the participation of 25 state leaders and 3 regional coordinators with professors from PAHO and the Secretariat of Health of Mexico. In May, the first training was finished, and the group then was ready to replicate the training sessions, and that will be held with a clinical leader in a virtual session with the group. This slide shows how this virtual training course was an excellent option. Until April and May, we had been able to train, because of all these COVID problems, 500 physicians. But in May, we concluded with the training of state clinical leaders. And like by August 2020, we already have 16 um, state entities that have begun their training, and almost 10,000 physicians that have been trained. So, of course, this is huge progress that was achieved with this virtual option, which PAHO has helped us with. And the next slide shows that once we have consolidated this and COVID is starting to decrease, some states still have problems for training. A complementary option emerged here, and that is the self-learning course for the diagnosis and management of dengue. It's a course of 7 modules with 20 hours approximately of duration. And in 1 week after opening registration, we already have more than 1,100 registered students and more than 660 that have passed the course. In Mexico, we have situation uh, where we offer all the students registered to meet virtually with a series of experts so that they can comment the contents of the course or have questions and discussion. Here we see the plans, the future plans. We have had a lot of support and that has been important, but in the plan, the Vectors plan is for 2021 to have a master plan for clinical training for all vector-borne diseases. Of course, dengue is essential here, and we are thinking of management and treatment of the diseases with a panel integrated by Mexican experts and experts in the area of quality and health um, care, and something that has been somewhat distant from these training efforts with the support of the National Institute of Public Health and, of course, with the support of the Pan American Health Organization in all referring to logistics of these courses. With this group of experts, of clinicians, we reach the regional advisors, and these regional advisors will become the mentors for training. They will be the group that will carry out the training for state clinical leaders so that they in turn will train the first and second level of care in each of the various entities. There's an important part of this master plan that is the monitoring and assessment of the methodology for distance training. This is something we still need to work on to have more experience and make further progress. We see here that Mexico has implemented some strategies in the new health program, and one of these is the dynamizing strategy, which based on the pillars uh, approaches some of the priority programs. And here we have included dengue, and dengue is one of the basic components in this line of work of the dynamic strategy, because healthcare will be um, taken by the first contact, the personnel. They will not only work for primary care, but they will also be a staff that can support the information in healthcare for prevention and damage and risk reduction, and to bring all this information to prevent serious cases and prevent deaths. We hope to strengthen the response of the local healthcare systems with all this strategy.
In this slide, we see how in week 9 we had 108% more cases when compared to 2020, compared to the same week in 2019. In week 22, when we go into the new normality, this reduces up to 42%. See the distribution of the transmission and how weeks 9 and 22 are very similar. There is a state that disappears in the Yucatan Peninsula, but the distribution is very, very similar. However, in this slide, we can see what happens 1 month after the ending of the lockdown. The transmission goes to other provinces, confirming that the intra-home transmission had an important role in this, as well as the mobility of the population disseminating the virus. Here, I would like to share with you this sort of residual outbreak at the end of 2019 and how this increases throughout the beginning of 2020. Currently, in this slide, what we see is the drop that was seen as we began the lockdown and the drop of the entomological vigilance also. And this is recovering as the lockdown finishes. And in this slide, we see as the activities were near discontinued, although we had a lockdown, and the actions, the peri-domiciliary actions and in open spaces continued throughout the lockdown, and this was really important. In the next slide, we can see that the personnel worked in brigades, in sanitary modules, fumigating spaces for COVID-19, mm, elaborating material to promote the health. And in the next slide, we have two more slides that talk about the strategies used for the COVID-19 and how they gave us valuable information so to understand more the dengue epidemiology. Mexico is we have maintained epidemiological surveillance at the same levels observed in previous years, and this is really important. We are still having a sample level of 40%, where the average is 30%, and a positivity of 23% of the samples, when the normal positivity is between 30 and 35%. This means that the transmission is being controlled and that the transmissions that we see in the different communities has to do with the dengue hotspots. We have made a small revision studies, and we have lost the opportunities to treat our patients. We are even having an early consultation because the people think that they might be having COVID instead of dengue. If the patients are taken care in time, there is an opportunity for us to improve the clinical management of our patients and to act in the prevention scenario, detecting all the or signs of alarm for the dengue. So with this detection, we can avoid the presence of the severe cases. This is what we learned from COVID in Mexico. I have made a review of how we've lived this outbreak of the COVID together with the dengue.